activity requires the combined and coordinated interaction of the upper motor neurons, the lower motor neurons, and the cerebellum. To assess motor activity, you inspect the muscles and test strength, muscle tone, and coordination. Reflexes test both motor and sensory functions. Start the neurological exam with some screening maneuvers. Ask the patient to walk across the room, turn, and come back. The face and head should lead the rest of the body on turns. The gait should be relaxed and balanced, with easy alternate arm swing. Next, check cerebellar function and position sense by asking the patient to walk heel to toe in a straight line. If there is difficulty, perform a Romberg test.
Okay, you can turn around and walk back. All right, you can face me.
Ask the patient to stand with feet together. Normally, the patient should be able to maintain this posture, first with eyes open, indicating intact cerebellar function. Then, with eyes closed with only minimal swaying, indicating intact posterior column function. If a patient maintains this posture with eyes open but not with eyes closed, he has a positive Romberg test.
Good, open your eyes now. Watch me, what I want you to do.
If appropriate, ask the patient to hop in place. This ability indicates an intact motor system in the legs, normal cerebellar function, and good position sense.
Hold it. Now what I want you
To screen for quadriceps muscle strength, ask the patient to do shallow knee bends.
Sure, wait once more. Sure. Next, what I want you to do is just walk
Ask
on
the
your
patient to
toes.
walk on his toes to test strength of plantar flexion,
That's good.
and then on his heels to test dorsiflexion at the ankles.
On your heel. And come back in. Good. That wasn't bad, was it?
Screening for upper extremity strength may be limited to two areas. First, ask the patient to hold arms forward and parallel with palms up, eyes closed for 20 to 30 seconds. Watch for downward drifting of one arm with pronation of the forearm, suggesting a hemiparesis. Normally, the initial position can be maintained. Next, test grip. Cross your middle and index finger to protect them. Ask the patient to squeeze as hard as possible while you try to remove your fingers. Normally, you should have trouble doing so. If abnormalities are noticed or suspected, proceed to a more detailed examination.
Just want you to relax, put your arms by your side. I'm just going to be looking at your muscles.
First, inspect the muscles of the arms, noting any atrophy, fasciculations, involuntary movements, or abnormalities of position. None are seen here. For an accurate evaluation of muscle tone or resistance to passive stretch, the patient must be relaxed. Take one hand in yours. Support the elbow. Using one coordinated maneuver, flex and extend the patient's fingers, wrist, elbow, and shoulder. Arm movement should be easy and smooth, with little resistance.
I'm going to be testing your legs now.
To assess muscle tone of the legs, support the patient's thigh. Grasp the patient's foot. Flex and extend his knee and ankle.
That's good.
To assess muscle
Will you
strength,
please raise your arms
use
in front
force
straight up?
compatible with the strength of your patient.
them up there. Don't
Begin evaluation by asking the patient to hold his arms out and resist your effort to push them down. Note the degree and symmetry of strength. Then, ask the patient to push forward against your arm. Watch the scapula on each side for winging or displacement, indicating a weak serratus anterior muscle. Test flexion and extension at the elbow by having the patient pull
Do the same thing, you have to pull it in.
and push against your
Put my
hand.
hand out. Do the same thing.
Test the wrist.
Good.
Ask the patient to make a fist, cock it, and then resist your pushing it down. Again, test the grip by asking the patient to squeeze your fingers. Normally, you should have difficulty removing your fingers.
Good. That again here. That's good. Now open
Ask the patient to spread the fingers.
real low.
Check abduction by trying to force them together. Test flexion of the fingers together with adduction and opposition of the thumb.
Just like that. Hold it up.
Instruct the patient to hold the thumb tightly against the fingertips. Assess strength bilaterally.
Just like that, right up here. Good. Now bend your fingers.
Repeat with thumb and little finger. If weakness is noticed, check finger strength.
Pull your fingers, bend your fingers, all of them. Just one. Good.
Assess the muscle strength of the legs.
Strength of your
Test
leg
flexion
muscle.
at the hip by placing your hand on the patient's thigh. Ask the patient to raise the leg. Compare with the other side. To test abduction at the hips, place your hands firmly on the table outside the patient's knees. Ask him to spread his legs against your hands. Then to test adduction at the hip, place your hands between the patient's knees and ask him to bring his legs together. Assess strength. Test muscle strength at the knee.
Don't let me bend it.
Assess extension by asking the patient to keep his legs straight as you try to flex it. Note the strength and compare it with the other
I
side.
want you to bend your right.
Assess knee flexion by flexing the patient's leg. Ask the patient to keep it down as you try to straighten it. Note the strength and compare with the other knee. Test dorsiflexion and plantar flexion at the ankle by asking the patient to pull up and push down against your hands. All these tests can be performed with the patient seated and holding onto the table for support. Hip flexion, hip abduction, hip adduction, knee extension, knee flexion, ankle plantar flexion, dorsiflexion. Next, assess coordination by evaluating rapid alternate movements. This is a function of the cerebellum. Have the patient pat his legs as fast as possible, then turn his hands over and back. The dominant hand may be better coordinated. Lastly, have the patient rapidly touch each of the fingers with the thumb in sequence.
Good. Now with all the fingertips.
Next, assess point-to-point movements. Ask the patient to touch your finger, then his nose. Observe the smoothness and accuracy of pointing. Erratic or inaccurate movements suggest cerebellar disease. Then tell the patient to continue with eyes closed. Inaccuracy that appears with eyes closed suggests a loss of position sense. Repeat for the opposite side.
All right. I want you to
Assess
tap
coordination of the lower
my
extremities.
hand with your foot.
Ask the patient to tap your hand as quickly as possible with the ball of each foot.
Good.
Note any slowness or awkwardness. Compare sides.
Faster. Faster.
For point-to-point testing, ask the patient to place one heel on the opposite knee.
Put it down, take-
Then run it down his shin to the
way
foot.
down. I want you
It
to
should
do
be
the
done
same
smoothly and accurately.
with your left.
Note any tremor or awkwardness. Assess both legs.
That's very good.
Deep tendon reflexes, sometimes called muscle stretch reflexes, are motor responses to suddenly stretched muscle fibers. Such stretching sends impulses along afferent nerve fibers to synapses within the spinal cord. Efferent fibers then carry the impulses back to the muscle fibers causing them to contract. Interruption of these monosynaptic arcs anywhere along their path will cause loss of the reflex. Deep tendon reflexes are graded 0 to +4. 0 is complete absence of movement. 1+ indicates a reflex that shows only slight movement.